Light bulb, it's not, I think it's the worst sign in radiology, maybe because I keep missing it. Posterior dislocation, so far less common, 5% at best. Who classically gets it? The stories say that it's someone who's been electrocuted or someone who's had a seizure. I once saw on a request form, patient had seizure after electrocution. I was like, yes, this is going to be a dislocation. It wasn't. Well, maybe it was a light bulb and I missed it, who knows. But this shoulder is clearly abnormal and it's not falling forwards and inferiorly like the last couple of cases. It's not an anterior dislocation. You can see that there's incongruity of the glenoid margin and the humeral head. And one view is no view, always get at least 2 views, and we can see quite easily now the humeral head is falling backwards. It's a posterior dislocation. Here is our classic light bulb. I won't continue with my disappointment of this sign. Probably only 10 or 20% do I see it. But you can see this is abnormal because we're looking straight down the glenoid and the humeral head shouldn't look like that. We have a look at an axillary view. Here's the clavicle out the front, the coracoid and the clavicle, and that humeral head is definitely going out the back. So we've confirmed it's a posterior dislocation and, well, yes, a light bulb. More commonly, posterior dislocations, they can be subtle and you're like, there's something wrong with this. I need extra views. Here we can see there's obvious overlap of the articular surfaces of the humeral head medially and the glenoid. There's also this lucent trough here called the trough sign, which is an impaction fracture of the medial aspect of the humeral head. We do a second view and we can see posterior dislocation. And when we CT that same patient, we can see an impaction fracture looking very much like the Hill-Sachs did back here, but it's anterior. So what are we going to call it? I think we should call it a Sachs-Hill. That would be my... But I don't know if I'd get away with that. So we're going to call it a reverse Hill-Sachs. So a reverse Hill-Sachs, and guess what we're going to call the posterior labral injury or glenoid injury? A reverse Bankart, reverse bony Bankart injury. Okay, so they occur in the posterior shoulder dislocation.